Hi Rachel, congratulations on 35 years. It is truly a privilege to get to work with you, and thank you for hiring me. I was reading about what makes a leader, and it says a leader is one who knows the way, goes the way, and shows the way, and that is you. I am so excited that you're now my boss again for the Cancer Care Center and that we're growing. I want to show everybody the two things that make you a great leader. You should give us this all the time, and this is the foundation, and this is going to be what continues us to grow in the future with your leadership. So thank you for all that you do.
Rachel Gardner was already here when I started working at Nanticoke in 1986. Over the years, she's been in many areas of leadership, and I've always respected her and admired her. Rachel became my supervisor when she took over the role as the director of the Cancer Care Center. She is amazing and has done so much for our Cancer Center in just a very short time. Rachel informed me that she likes a challenge. She follows the pillars of excellence and expects everyone that works with her to follow it also. She has high expectations of her staff as well as herself. She has already taken the time to learn everyone's role at the Cancer Care Center. She is a go-getter. She knows what she wants and how to get it done effectively. Most importantly, Rachel is a patient advocate. Everything we do at the Cancer Center is done for what is best for our patients. She is an excellent role model, and she is an asset, a great asset to Nanticoke Health Services, and I am proud to be working with her.
Congratulations, Peggy. You've been here for 35 years. Lots of good things to say about you in so little time. Everyone who's known you for this long told me that you are an absolute expert in your field and you love working with little people. You started out on peds, you worked there for several years and came over to here to continue in the nursery. A funny story about that, Beth tells me that you once had to take care of a child who needed a suppository. The little boy asked how he was supposed to hold it in, and you told him to hold his cheeks. So he did. All night long. But on a more serious note, you're an asset to this unit, most notably recognized for the amount of time put into education for the families and the staff. Those who have been here a while always learn something new from you. We look forward to working with you for many more years to come. Thank you again. Congratulations.
Hi, I'm Candy Sammons, and I'm here to speak for Robin. When I first came here, I heard stories about Robin, that she was very, very shy when she first arrived, and that she had a pet goat that she would bring to the hospital for staff meetings and leave it tied up outside of the hospital. A few years ago, she took over the job as charge nurse, and the staff today were unable to come, but everybody, as you can see, has given me all kinds of nice things to say about her. So I'm going to go on with those now. We have that she's a team player, that she's understanding and caring towards others. One of our nurses feels that we need to put a GPS tracker on her clipboard because she's always losing it and we can't find it. She's also bad about losing her pens, but she says she's fair, honest, loyal, dependable, and a born leader. We also have that she loves coffee, and then I'm going to add that she loves peanut butter, and the peanut butter better be fresh because she doesn't like it if it's stale. She takes pride in her children and grandchildren, and she's very, very devoted to her family. Robin is an Energizer bunny. She is a non-stop movement. She's walking thousands of steps every day. She greets her patients warmly and treats them like family. She inspires each and every one of us and challenges us to multitask non-stop. Other nursery, when I think of Robin, two words come to mind: energetic and dedicated. She's always willing to jump right in and willing to help others whenever she needs. She runs a tight ship and keeps us all on our toes, making sure that we are running as smoothly as possible. She makes me feel appreciated. Now, as you can see, we've all talked about Robin, and she is just an excellent charge nurse. but this is just part of it. She is responsibly committed to Nanticoke Health Service. She is organized with her hardworking, energizer, budding personality, kindness, and professionalism. She always inspires staff, volunteers, and patients with her compassionate demeanor. Her nurturing character makes her a true nursing leader that Nanticoke has been fortunate to employ for 35 years. That's it. I hope you all get to meet Robin tonight and congratulate her on her 35 years. Thank you.
Congratulations, Dawn. You've been here for 35 years in Nanticoke. It's been recognized that you are one to be very reassuring to parents and their families, especially in times of stress. You've recently been nominated and received the Nurse of the Month for May 2018, so congratulations on that as well. Funny thing about you, you are well known to wrap babies very tightly. They jokingly call it baby burrito. No one can do it quite as well as you. Thank you for all years of service. Here's to many more.
Hi Terry, congratulations. Can you believe it's been 35 years? I can't. From my first charge nurse when I started here at Nanticoke Hospital on Fox Wing, I remember the night shifts with you. My first code was with you and teaching me how to get that crash cart. I really appreciate you guiding me through that experience and truly being my friend throughout this experience. Now I get the pleasure of working with you on SSU, and you're continuing to help the young nurses grow and meet their potential. As it says, a leadership is practiced not so much in words as in attitude and action, and you truly have always been a leader and guidance for the new nurses and your staff. So thank you for all you do and congratulations.
Good evening, my name is Colin McLaughlin. I'm an RN at Nanticoke Hospital in the operating rooms.
And I'm Karen Womack. I'm the charge nurse in the OR, but most of you know me as OR Womack.
We'd like to take a couple of minutes tonight to salute our co-worker, Melinda Huffman, who is celebrating her 35th anniversary as an employee of Nanticoke Hospital. I first met Melinda back around 1993. I was starting at the hospital as an RN on Fox Wing. She was just joining us as a nurse, I believe, at that time. She had worked as a lab tech for at least a decade prior to that. We worked together for a year on Fox Wing, then we graduated to ICU together, and we moved along. I went to the ER, and I believe that Melinda went to endoscopy. Our paths rejoined a little bit later in endoscopy, and then Melinda left for the Cancer Care Center. After a period of time, moved to the OR, which was something we both wanted to do, but Melinda joined us a little bit later. But I'm glad to have her back where she belongs, at my side.
I have been blessed to have Melinda at the end of her career. Being in the OR was on her bucket list, as she told us when she was interviewed. So I'm so happy she's here. Melinda moves like faster than lightning. She's always on the go. She does anything that anyone wants her to do. She's an excellent OR nurse, but most importantly, she is our cake lady. Every birthday for every co-worker and every doctor gets a cake. There may be 5 cakes on one day, but she makes them exactly what they choose. So she just helps morale and brings a lot of happiness to the OR. So Melinda, I'm glad to have you. I'm glad to have you during your 35 years at some point, and knowing you, you'll have 40. So congratulations, and we love you, don't we, Colin?
We sure do. Congratulations, Melinda.
We wanted to share a little bit about Janelle McElroy. She has been a part of our department for the past 10 years as our director, and prior to that she worked as a case manager for PCU and ICU. Prior to that she worked for First Choice Home Health, and she had worked her way up as an LPN and then as an RN on Foxwing and ICU. She also worked in conjunction with the hospitalist program. She has been taking our department through many changes and consultants to become what it is today. She's been president of the ACMA Maryland and Delaware chapter. We've been recognized at our national case management conferences and also at Maryland chapter conferences as an innovative leader. She's promoted teamwork, collaboration throughout our organization and with other organizations. She has seen our department through many IT changes and development of IT processes for referrals and communication to outside resources. She's been a proponent of change with regard to COPD and CHF programs and communication with our NPN and outside agencies. She's helped improve our community's health through partnerships with multiple agencies and helped improve case management communication with those partners.
Janelle, we just wanted to thank you for the dedication to our case management team and to all of our Nanticoke family.
Happy 40th, Janelle!